Good afternoon, everyone. I am Dr. Satyabrata, MD/DM clinical pharmacologist, and today I am going to discuss on management of cervical spondylitis. We all know that cervical spondylitis is an autoimmune disorder. It affects the neck, joints, and neck region, and it can also related to the genes. So the causes can be genetic and autoimmune also, and there will be neck pain, neck stiffness, morning stiffness, and pain during the movement of the neck, and the pain can also in the back region, and there might be headache and other symptoms like loss of coordination, improper movement, and weakness, fatigue, etc. So for diagnosis of cervical spondylitis, we can advise for MRI, cervical spine, to look for soft tissue changes and disc changes, and we can also do CT scan to find out the soft tissue changes and changes in the disc, and we can do HLFB27 test, and generally for cervical spondylosis X-ray, neck epilateral to be done, but cervical spondylosis is different from cervical spondylitis. Cervical spondylitis is an autoimmune disorder, and there will be inflammation of the neck joints, but in case of cervical spondylosis there will be different manifestations. So we will talk only on cervical spondylitis today, and I will take another class on cervical spondylosis. In cervical spondylitis, we can diagnose it through all these investigations, and the management is that the drugs used in cervical spondylitis are NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, aceclofenac, etc. And other drugs like we can use biologics like infliximab, adalimumab, etc. if it is severe, or corticosteroids we can use as an anti-inflammatory agent, and as it is due to bad posture, we have to maintain our posture, and physiotherapy is very much important in this case, and we can also advise the patient to avoid overhead pillow, to maintain normal posture of the neck region, and there are also lots of other managements. There is also non-pharmacological managements like physiotherapy, other hot and cold compression, and we can manage this cervical spondylitis in proper way if we diagnose it early, and in case of severe case of cervical spondylitis, we have to consult orthopedic specialists and other specialists, physical medicine rehabilitation specialists, and for treatment reconciliation we can consult clinical pharmacologists, particularly DM clinical pharmacologists, for the management of cervical spondylitis. And this cervical spondylitis can affect the quality of life of the patients. So after treatment we can compare the quality of life by using some quality of life questionnaires like WHO or other quality of life questionnaires. And as it is an autoimmune disorder, this is very difficult also to manage these patients also. So in case of severity of cervical spondylitis, visit to your orthopedic specialist, physical medicine and rehabilitation specialist, physiotherapist, and if there is requirement of surgery due to complications, then you can consult the particular orthopedic surgeons so that you will be managed properly and you can lead a good life. And you can go through different articles, different guidelines on cervical spondylitis management, and you can know a lots of things from that also. So please subscribe and completely watch my videos so that you can learn a lots of things about different diseases and their managements. So happy Saraswati Puja to all of you. May God bless you all. Thank you very much. That's all for today. Jai Jagannath.